Hello, thank you for joining us today. My name is Alvaro Mestre. I'm a Vice President of Account Management at Infoway, and I'm here today with my colleague.
Hi, it's Kjargaard of Canada Health Infoway. Thank you for joining us.
So today we want to talk to you about our activities for national qualification of vendors. And we will be talking about the context and the process. We're going to give you an overview of what the pre-qualification process is all about, and talk about some of the activity that has been conducted, the benefits, and some of the future work on this area. So to provide some context, this initiative came about after extensive consultations with provinces and territories, and some foundational work that we conducted last year around solution requirements for virtual visit solutions. As a result of that, after we discussed with many jurisdictions, there was an agreement for Infoway to play a leading role in facilitating a multi-jurisdictional procurement process in the form of a pre-qualification of vendors. The focus of these activities so far has been on three categories of solutions: virtual visits, remote patient monitoring, and provider-to-provider collaboration. So what do we mean by pre-qualification of solutions? So you can think of this as a two-stage process from a procurement perspective. The pre-qualification is intended to identify solutions that meet a number of requirements that have been agreed with the jurisdictions. And then on the basis of that pre-qualification, the jurisdictions can proceed to a second stage in the procurement cycle, which is the RFP, or the request for proposals, inviting those pre-qualified vendors to bid on specific opportunities. This is based on coordinated approach, whereby we have essentially agreed or facilitating a consensus across provinces around requirements in terms of the rating of that pre-qualification criteria, and then establishing some matrix for success on this process. On the right-hand side of the slide, you can see some of the aspects that are covered in the stage one, the RFPQ, which is what we'll be talking about today, and then the aspects that are covered on the RFP, such as selection, negotiation, and contracting. So let's talk a bit more about the RFPQ itself. There was a need to strike a balance between a multi-jurisdictional view or pan-Canadian view around requirements, and then also having enough flexibility to support some variability across provinces. There was also a need to make sure that this process that would be facilitated for Infoway also complied with various requirements, various policy and process criteria that varies a little bit from province to province when it comes to procurement legislation and regulation. And finally, there was a need for us to find a mechanism and a process by which, given all the ongoing resource constraints because of the COVID pandemic, will enable the provinces to participate actively, but also allowing Infoway to take a leading role to facilitate the burden, to lessen the burden on jurisdictions, while still allowing the jurisdictions to be actively engaged in signing off and providing input throughout the process. I'm going to pass it over to Perry at this point.
Thanks, Alvaro. Early in the process, we worked with the provinces and territories to divide up the roles and responsibilities of this procurement effort. As you can imagine, there was things that Infoway would lead on behalf of the jurisdictions, but also that the provinces and territories were needed to be key players in certain elements. Through these tasks that are being identified here, you can see that the provinces and territories played a significant role in working on the requirements definition part of the exercise, and also during the evaluation of the proposals. This delineation of responsibilities was really key in working with provinces and territories so they understood when their expertise would be required over the life cycle of the project. When we look at some of the results in the virtual visits space, we worked with 10 provinces and territories during the late winter period of 2021. In that phase, we did requirements definition. The RFPQ was posted. The evaluation happened during the April and May timeframe. And that by early summer, we were into pool selection of the successful vendors. You can see in the middle section of this screen that we had large interest in the number of intents to bid. Bids were received, and you can see that 22 asynchronous vendors and 23 synchronous vendors were pre-qualified. As this was a public procurement process, a list of the successful vendors is available on our bonfire portal, and we provided the address to you here. And also of note that the pool will be refreshed during the procurement life cycle of the next 3 years, and the frequency of that refresh will be largely driven by the needs of the provinces and territories. When we switch gears to remote patient monitoring, again, you can see that we followed a similar pattern to the virtual visits. We did reuse the same framework, but we made a number of improvements to the framework given the experience of the first procurement. Requirements for RPM were gathered in that March timeframe, vetted with provinces and territories during April of 2021. The RFPQ for RPM was issued on May 19th, with 8 provinces and territories participating. And that by the end of June, we had gotten through the evaluation phase of the project. And shortly after, in the summer, the results were known and the packages were released to the provinces and territories for their use. Again, strong interest in the RFPQ from the vendor community. Lots of bids were submitted, and that 24 RPM vendors were pre-qualified. Again, this is a public procurement, so information can be viewed upon at this bonfire website that's on your screen. And again, a refresh of the vendor pool will happen again in working in conjunction with the needs of the provinces and territories. The third leg of the stool that Alvaro referenced early in the presentation was in the provider-to-provider collaboration space. And it's loosely defined as remote interactions between providers in various electronic forms, such as audio, video conferencing, secure messaging, file exchange, with focus on securely facilitating coordination and collaboration and the exchange of information. And that interactions can be either synchronous or asynchronous. In consultation with the provinces and territories, it was established that the immediate priority was on some precursor activities in anticipation of a future RFPQ in this area. And those 2 major activities were in the areas of a market scan and review and refinement of multi-jurisdictional requirements. This snapshot here of British Columbia's participation in this effort really highlights a couple of things for you. That they participated in both the RFPQs for virtual visits and for remote patient monitoring. That they then take the results of the work and work with their stakeholders in their province to take it to the next step. And you can see that they are continually using the results and working on solutions that were identified through the RFPQ process to take it to that stage 2 that Alvaro articulated before.
So just to conclude, it's important for us to talk about the benefits that this approach has yielded. And well, there are many benefits. We summarize them in three categories for today. So one clear benefit is really in terms of efficiency. By conducting an orchestrated, integrated, multi-jurisdictional pre-qualification process, there are obvious time savings for jurisdictions, for vendors. Simply said, instead of having, let's say, five, six, seven, pre-qualification activities that are jurisdictionally specific, we have one. So clearly, there's no duplication of effort, there's consistency, and then for the vendors, they don't have to respond to multiple requests. They can essentially concentrate their time and energy in responding to one, and then the result of that is, again, of benefit to multiple jurisdictions in terms of moving towards the stage two, the RFP itself, and negotiations and contracting and so on. So that's one. The second one is it's sort of related, but it's really about this also translates into an overall quicker process end to end, and ultimately that means that these capabilities can be accessible to patients more rapidly than otherwise. So again, there's a direct benefit for the ultimate end users, which are providers and patients in use of these technologies, particularly if we're talking about virtual visits and remote patient monitoring, where again, these technologies facilitate the interaction between patients and providers in a virtualized manner. And finally, there's an opportunity for all vendors, no matter how big or small they are, to benefit from a transparent and consistent process across, again, multiple jurisdictions, where they can showcase their capabilities and be measured or evaluated in a consistent manner, so it creates a level playing field and an open opportunity, no matter if you are a small vendor or you are an established vendor in the marketplace. So these are just some of the benefits, but I think it's important to highlight them. And the feedback that we've gotten to date attests to these benefits being realized by various parties involved in this process. So that's essentially our presentation for today, and we look forward to questions from you on what we have presented today. I hope you found this presentation useful, and Perry and I are available for further questions as well. Thank you.